So AI, I think, is touching every space of work and life as we speak. Even in the healthcare space, not just in the innovation side or drug development, even on the delivery side, which is the healthcare delivery, we're seeing a lot of technology being used. If I can give you a small example, out there in the IVF labs, the embryologists who essentially select which is the best gamete, which will be suitable for fertilization and hence aid the couple for a healthy offspring. A lot of AI is being used, so they actually depend on a lot of imagery, and they look at which out of the gametes that they have selected, which will have the highest priority. That's one. Similarly, on the preventive healthcare side, for example, we have a partnership. Apollo has a partnership with Microsoft, where using predictive AI, we are able to predict a cardiac risk score of an individual, and that's courtesy the thousands and millions of data points that we have across so many years, which now tells us that a particular individual at say 35, what's his probability of getting a cardiac ailment. So AI is being used across different segments of healthcare. So I think how life has changed in healthcare from a technology perspective is the last mile delivery to the patient, for example, or the consumer, as you would say. He or she has become a lot more technology oriented, right? Now you and I need not want to go to a hospital and meet the doctor. You would want to get in touch with your doctor or your clinical caregiver at the touch of your phone, through a mobile app, and that's one. Secondly, we are all in age of wearables. All of these are now aiding healthcare providers, both data scientists in a lot of risk modeling, a lot of modeling based on your actual outcomes. And as we have seen a lot of use cases, for example, they have helped predict actual episodes and get an alert done through either telemonitoring basis. We actually do that for our patients who are not necessarily now required to be in the hospital. They can be at the comfort of their home, but the care providers are monitoring them remotely 24/7 hours, right? So right from I think the last mile delivery, it changed a lot. Plus from an interaction perspective with the patient and consumer, that has enabled a lot of changes. So the traditional brick and mortar image of hospitals, now that's sort of moving very fast into a more AI, more technology driven healthcare delivery.